All right, I think we'll get started. Today's topic is the evolving role of AI in diagnosing and treating patients. I actually did a webinar on healthcare AI last year that had a much different tone. It was pre Chat GPT and GPT-4, of course, more recently. But I think the tone is very different. We're going to see quite a bit of difference between the way that healthcare AI has been in the past decade, especially, and what we're going to see going forward. And we'll definitely get into that. We'll start off here with a little bit about who's presenting this webinar. So, Inex Technologies. You could see that we are a fintech company. We're a tech company that does a lot of fintech solutions, Web3 solutions, as well as health tech. So I lead the health tech vertical. We've done quite a few projects in health tech as well as a fintech and Web3. And I have worked as a physician. I also was a consultant at Accenture. I was a physician consultant there for several years and also worked as a clinical product manager at an EHR company focused on medications. So e-prescribing, EPCS, all those things. Yeah, we're going to just kind of start off with kind of level setting. So I'm going to give a brief overview of AI. So when we say AI, it can mean a lot of things. So if we have any AGI enthusiasts, which is artificial general intelligence, that's what we. One second. Yeah, okay, great. What we see in the movies in sci-fi. So HAL 9000 and 2001: A Space Odyssey, Lieutenant Commander Data from Star Trek, Samantha from Her, and of course the machines that enslave humanity to use as batteries in the Matrix. That is not what we're talking about today. So what are we talking about? It's really going to be these computer systems that can perform tasks which were typically, or I guess previously, required human intelligence. So these tasks include learning, problem solving, understanding natural language, and decision making. So we've seen algorithms do decision making in the past. It was more of like a decision tree, and it would go down. But these algorithms are a bit more powerful, and it's really that the computers can learn from data and improve their performance over time without being explicitly programmed. So while you can look at what the formula is for stroke, and you could see what parameters you need to pulling them in and running the equation is pretty easy to program a computer to do. But if you show it parameters and you let it learn on its own, that's a different way that your software is working. So yeah, the reason I'm doing this webinar after the one last year is because that GPT-4 has completely revolutionized the landscape and has made top-tier AI easily accessible to all kinds of people and businesses. I saw a post where there was over 200 businesses launched in the weeks following GPT-4. So that only came out, I believe, in March. And of course, ChatGPT, GPT-3, 3.5 came out at the very tail end of November 2022 to the public. And since then, there's been a lot of excitement about AI. I'm also excited about AI. Like I said, the tone in my last one was very different because what we see in healthcare AI is really closer to using kind of this term AI without doing a lot of the real AI kind of work that we're seeing today. And the focus is more on finance, on revenue, revenue cycle management, optimization of operating rooms and things like that. Scheduling and things are what I saw before. So that's the reason I titled this The Evolving Role of AI in Diagnosing and Treating Patients. So we're not simply talking about the use of AI in the last decade or so, which has not been quite as impactful as I would have hoped. And here we also have HAL 9000 on the stethoscope on the right. So I'm going to talk a little bit about the benefits and challenges of using AI in healthcare. And of course, as you look at this list, you're going to say a lot of these are pretty much the same as non-AI in healthcare, which I'll say is true for several of these. But specifically for healthcare in diagnosing and treating patients, you do have to think about a few different benefits and challenges. So the improved diagnostics, this is kind of the tree that Nuance and IBM Watson Health were barking up for over a decade. And this is using AI to analyze medical images, patient data, and other information to help identify abnormalities or diseases by using patterns that may be missed by humans. And this was the potential to lead to earlier, more accurate diagnoses. So this was kind of previously done with a structured learning method where you would go through thousands or tens of thousands of x-rays, for example. It was a simple example, and say these x-rays have a broken bone and a bunch of x-rays that are normal. So you label all of the ones you circle, and you label and say, this is a broken bone, this is a fracture, this is a fracture, look at this, look at this. So when the system intakes all that, it'll look for those same type of patterns and it'll find them. So that's kind of the old way. And like I said, with the new GPT-4 architecture, there's much more powerful ways of learning, and we'll get into that a little bit later. But the improved diagnostics is still a huge benefit from AI in healthcare that I think we're going to see a lot more in the near future, I should say. And then personalized medicine. I've heard this a lot, and we'll talk about this a little bit more later as well. But this is kind of the analysis of genetic and clinical data to tailor treatments to individual patients, which is supposed to also increase the efficacy of treatments and reduce side effects. This is another one I've heard of for years, but I don't think anyone here has gone to their physician, especially their primary care physician, and had anything close to this experience in the last 5 years ever, I'd say. So it's really something that is going to be coming, but when it will be kind of available to the general public remains to be seen. There is a talk next week at HIMSS I'm looking forward to with one of my old colleagues at Accenture, Dr. Cecil Lynch, and he's talking about this specifically. So I'll definitely learn a lot there next week. And also the next one we'll see is drug discovery. We've already seen this happening, accelerating the drug discovery process. So it's able to identify potential therapeutic candidates, predict their effectiveness, and which is supposed to save time and resources. Of course, there's still kind of the bureaucratic hurdles to get through. And of course, we have to make sure everything is safe. So this is going to also be improved. But, again, we're looking through the lens of diagnosing and treating patients. So this would be something really cool if we're able to get drugs faster and easier to market. Repetitive tasks. This is one of my favorite ones, I think. AI systems can automate repetitive tasks. So let's forget, I guess, scheduling, billing, and data entry. Those I think it'll be more of a collaboration with your front office staff at hospitals and practices. But the administrative burden on healthcare professionals is massive today. People spend so much time, physicians spend so much time filling in EHR data, and it's all towards billing, and it's a lot of repetitive things. You end up treating your computer instead of the patient. So what would be great is if the AI was able to automate some of these tasks that they have to do and allow the doctors and nurses to focus on patient care rather than focusing on cataloging everything that they did, because there's the old adage in health insurance, that if you didn't document it, it didn't happen. So the onus is on the physician to document every dang thing that you do, and that's so that you get paid for the encounter. So this would be really nice. This one I'm really looking forward to. Telemedicine and remote patient monitoring. This is also another good one. I think we've already seen AI-powered chatbots and virtual assistants. I'll talk about a company later that's doing this, that's been doing this for a few years. But basically, you can provide health advice and triage services remotely. And that's a big help. And wearable devices and smart home technologies also allow you to get that kind of early intervention and monitor patients' health. And again, it's not like in the past, even before the internet, when you had those old cell phones and things, you could send a patient home with a cardiac monitor and it would transmit over the phone every once in a while, and you would see. But obviously, you're not doing that for everyone, and that required a doctor on the other end to look at it. But Now we see there's companies like AliveCore, which have smart devices that will monitor your heart rate, your heart rhythm, I should say, excuse me, and it looks for different things, arrhythmias and things like that. And when it detects them, is the only time when a real person needs to get involved. Until then, your phone is doing the analysis. It's saying everything's fine, or hey, there's a problem. Do you want to get a specialist involved? So those things are really great when you can kind of reduce the burden on humans and have it done a little bit more through technology. All right, and so the next one, challenges. Let's get into challenges. Data privacy is already a challenge. It's not that different in AI. Of course, the analysis of sensitive health data by AI systems does raise concerns, but I think that goes more into the ethics bucket on the bottom. Integration with existing systems. Of course, this is a huge problem today with just any health tech. Very siloed. Everyone's been saying this my whole career, 12, 13 years. I've heard the same thing. No one wants to solve it. As much as people, I've heard of all the different standards, FHIR, before that, HL7, everything is kind of bucketed for a reason. And it's, I think there's certain people who want to solve it, but the people who control the data, it's kind of a conflict of interest. You really don't want to open up that data for everyone. You want to hold on to that. So it's a little bit of an unfortunate situation, but integrating AI in healthcare would require it to integrate with existing health systems, which may be complex and could be costly, but I think it's going to, again, improve diagnosing and treating patients in the end. So bias and fairness. So this one, we've already seen AI algorithms trained on biased or unrepresentative data, and that perpetuates or exacerbates existing disparities in healthcare, which could lead to unfair treatment recommendations or diagnostic errors. So you really need the data to represent your population. And I won't get into the specific AI algorithms that were unbiased data, but it's not really healthcare related. But I do recommend that you look some of those up. Ethics, I guess regulatory is in the ethics bucket too, but really the use of AI in healthcare, there's a lot of ethical questions, legal questions, like determining liability or addressing the black box problem where the AI decision-making processes are not easily understood by humans. And I have something a bit later about informed consent to that same end, where can you really have an informed consent when you have no idea how it came up with this answer? And then the last one, training and adoption. It's not only kind of training your healthcare professionals to use AI tools effectively. I think there's already a lot of concerns about job displacement, maybe even the dehumanization of patient care. I would say that the job displacement folks have kind of been saying similar things for a lot of different industries over the years, but I think it's a lot more evident today because people are seeing the power of GPT-4 especially, and seeing how they could easily be displaced. So obviously the rise of telemedicine, everybody knows obviously that this was forced by the lack of in-person availability during the COVID-19 pandemic. But really it's that telemedicine has also improved access to care. Patients who are in remote or underserved areas are able to consult with health professionals, which is really overcoming geographical barriers and reducing the travel time and cost. There's a bunch of startups that were kind of shuttling people, especially the elderly who have a hard time getting to appointments in person. They were kind of shuttling them there and back. We even saw Lyft for healthcare and Uber Health both came out with things of doing the same. And these were reimbursed by Medicare. So this was the first kind of thing that we saw in real life, I guess you would say, in the physical world. But this has, we keep seeing that rural communities are continuing to struggle with health equity in America. So this is another way that we can get in there and get patients to see physicians. Chatbots. So I talked a little bit about this before, but these AI chatbots can really triage symptoms and recommend appropriate care pathways, I would say, is more than anything than giving actual health advice. So this really augments telemedicine services. So there was a company called Giant, Gyant, that has been doing a virtual front door for triage for years. So I'd expect that their capabilities will take a huge step forward with GPT-4. Not sure what system they were using before, but if you even think of going to websites where they have that pop up on the bottom right of the screen, I'm sure Ionix has it as well when you go to their website. But when you have that, it's kind of, you could tell that it's clearly a bot to start, and at a certain point, you may get a real person. But if you do kind of the Turing test on the original bot, everybody knows it's a bot. But rather than make it seem like a real person the whole time, where you know it's an AI, I actually thought it'd be interesting to start with that old kind of feeling of an obvious bot, and then rather than being passed off to a real person, it would be the advanced AI. So you can even have the advanced AI start off as the bot and move on, because I don't think anyone believes that when you go to a website, you're getting a human instantly as soon as you start typing in that box, because there's probably a lot of people typing in the box. But yeah, so those chatbots and virtual assistants are going to make things a lot better as well. And the last thing, patient engagement on this page. This is really, telemedicine combined with the AI-driven personalized health recommendations that I mentioned on the previous slide. So this really can encourage patients to take a more active role in their health, which hopefully will lead to better outcomes. And really, the reason that I think AI is going to make a big difference here is that the ability to engage and understand nuance that we've seen from GPT-4 is incredible. So really, I think that's what was missing in all the other iterations of any kind of AI. I worked with Amazon Comprehend Medical years ago, and theirs was like, I mean, the UI was obviously not conversational, but I could send it something and it sends me back a JSON object, and I have to kind of look at it and be like, okay, the confidence interval is 90%. This is so, like, it would send you back a bunch of data, but it wasn't any way that you could really interact with it unless you're able to, I don't know, like, understand how to send things and receive from APIs and kind of decode what's sent back. With GPT-4, you just send it regular text, it sends you back regular text, and it really understands nuance. So if you say, I have type 1 diabetes or type 2 diabetes, and this is the thing, it will give you a really like nuanced answer. I really like the way that GPT is doing this. So I think for patient engagement, it could be really powerful. So the AI-powered diagnostics, I mentioned earlier IBM Watson Health, which is now defunct, of course, and Nuance Communications have been working on this for over a decade. I talked to them both a few times over the last decade and followed up on their progress. I haven't seen this kind of moving forward. Like I said, this was based on that old kind of structured learning, machine learning methodology where you teach it where you show it a bunch of labeled things and you hope that it can go forward and do this. I've heard of companies doing this in pretty much every country all around the world, trying to have this breakthrough. I think there's still some path forward for that. But I think with the new kind of architecture we've seen with GPT-4, that with the kind of transformers, if anyone here has read the paper "Attention is All You Need," that kind of changed the landscape. That was the kind of the seminal paper there that everyone should read. Yeah, really, I think that this can go a lot further now, because we do know that GPT-4 is multimodal. We could see a lot of interesting things coming out of this based on what we give it. And then the second one is pathology and histology. I put this as a separate point because I think medical imaging has gotten all of the hype in the last decade plus. Everyone talks about X-rays and CTs, but I really added this bullet point because AI can analyze microscopic images of tissue samples as well. So to detect cancerous cells or other pathologic changes, microcalcifications and things like that can be detected by AI. And you just don't see the hype of that as you do of X-rays and CTs, which maybe are more understandable to the general public. But imagine doing like a FNAC, like FNA cytology in a large thyroid gland. You can train the AI to look for Samoma bodies to identify papillary thyroid carcinoma, for example. And this would, it would be able to look at these and just tell you, right? So, so I think pathology and histology are two that really I just wanted to call out, which are related, but not exactly the same as the medical imaging analysis. And then even the early stage cancer detection. So this is kind of the small tumors, irregularities in tissue structure. And one that I read was changes in blood flow patterns as a precancerous thing that it can detect. So this would augment current early detection like mammograms and fecal occult blood. That's just one more kind of data point. If you can get this kind of at scale, you may have, I mean, we'll see what the false positive rate is on these, but at least you can tell people to go get checked. Because right now we have kind of, I think, archaic systems for when you check for certain things. It's like, oh, do you have a family history of colon cancer? Okay, then you get screened 5 years earlier. And I guess it works at scale, but I think if you're looking at a more personalized medication in the future, you don't want to just kind of blanket everyone and say, all right, check at 50. All right, now we're making it 45. Because I think these decisions are more based on financial reasons than because do you want everyone to be getting flexible sigmoidoscopies or colonoscopies? Probably not, but you do want that data for those who will slip through the cracks. And it's not like, to them, it's not just a number, right? It is their life. So I think if we're able to get this out at scale, it'll be really cool. And diabetic retinopathy. So if you don't know what diabetic retinopathy is, it's an eye complication caused by diabetes that damages the blood vessels in the retina. And this does lead to vision loss if it's left untreated. So I knew about this because I actually applied to Google Brain in 2017 for a role. And this was around a smart contact lens they were making to detect diabetic retinopathy early in diabetics. So before you feel like you're losing vision, it's able to detect the early changes by wearing a contact lens. And once it detects that, so diabetics could wear this, I guess, even if they don't need contact lenses, this would just detect. And if they needed, I'd assume it could also correct their vision as well. So this was really cool. I forgot about this, but I looked it up again today, or I guess yesterday, and it looks like Verily Life Sciences, which is a branch of Alphabet, took over this project, but it was paused in 2018 due to challenges in obtaining accurate and consistent measurements from the contact lens device. But regardless, I did put it up here because that was 5 years ago, and hopefully we'll see similar things in the future, because this is, again, like a pretty cool thing, because you don't want to wait until you feel like you're losing your vision to treat it, because you're not going to be able to undo whatever amount you've lost, right? So this is an irreversible change in diabetics, and it would be really cool if we could catch it before they have any problems. So the personalized treatment plans, I touched on this a bit, and I also talked about Dr. Cecil Lynch, who's speaking next week on this topic at HIMSS. So since I've heard about precision or personalized medicine for years, there are significant gaps in integration of the findings of kind of the genetic research that we've known for years, but getting that into everyday care episodes. So being able to really figure out what those gaps are is what Dr. Lynch is talking about next week. And I saw his kind of blurb from that, so I'll take, and what he says is the clinical genetic training gaps in primary care physicians, the focus of clinical genetic researchers on the research aspect of their work rather than the clinical side, and the lag of the EMR API ecosystem to external data integration are the gaps. So really, it's why don't we have precision medicine? Why don't we have personalized treatment plans? Why are we still working at scale? If you're 40 and you have a direct family member who had the same cancer, cool, you can get screened, but everyone else has to wait another 5 or 10 years. Otherwise, it's not covered by insurance. And they probably won't even know about it, to be honest. So yeah, those are really the reasons. It's primary care physicians aren't being trained in this, and the clinical genetic researchers are way too focused on the research aspect. And the last one is the EMR API ecosystem. They just don't have a way to get that external data in and out for those genetic testing results. I think that last one should be a lot easier, and we should see how we can do that. But yeah, so be on the lookout for this in the near future. And if you're also going to be in Chicago next week, like I am for HIMSS, so be sure to attend Dr. Lynch's talk on, it's titled How the Human Genome is Changing Precision Medicine, and it's on next Wednesday. So we're almost done here. I think it's the last content slide. So the ethical considerations. So we've already seen in health, multiple AI algorithms exercise bias, and that's really more being trained on unrepresentative data is the biggest thing. So things like race, ethnicity, socioeconomic background are already underserved with our current mechanisms. So health equity is another hot topic in America right now. I've seen Dr. Bott from Deloitte talking a lot on health equity. So there's a lot of problems right now, and I think for the bias and fairness ethical consideration, what we really need to think of when we're thinking of diagnosing and treating patients is that we should make sure that AI doesn't further exacerbate this problem. So this problem exists. We all know it. We're working on ways to do it, but AI, if it's working off unrepresentative data, could make it worse, is all I wanted to point out. Transparency and explainability. This goes along with the last point too, the informed consent one, but really the AI decision-making processes should be transparent and understandable to both healthcare professionals and patients. What's great is that GPT-4 does a really good job of explaining things based on context. So you could say, I'm a healthcare professional, or if it knows that you're a healthcare professional, it will use jargon and make things easy to understand, quick to understand. If you say, I'm a patient, I don't have a medical background, it'll explain the same thing in a much different way so that you're able to understand. So I think the explainability is going to go forward a long way here. The transparency, maybe not so much. Like I talked about the architecture of GPT-4, we know that it uses transformers. We know but we don't know, how exactly it works, what the exact architecture is, how it works. But we know that it's using these transformers from that paper I mentioned. So even though they're called OpenAI, they don't open exactly what the architecture is. So it is a little bit non-transparent. So it would help build a little bit of trust if we can kind of get that informed decision making in the process. So liability and accountability. I hear a lot of people talking about this too. I think as AI systems make a more significant role in healthcare decision making, you do need to establish guidelines for liability and accountability in cases of misdiagnosis or other adverse events from AI-driven recommendations. I think overall it will be ultimately the physician's responsibility to agree with the AI recommendation or not. Just like Tesla's autopilot, neither Tesla nor their neural network is responsible for crashes. Every time you activate it, it tells you the driver must stay vigilant at all times, and it pops up with that. So maybe it's just a disclaimer or something that the physician acknowledges, but you're not going to be letting the AI treat the patient entirely and let it take all the credit/blame. I think you're still going to have to ultimately kind of collaborate, which takes us to our next point. It is the human plus AI collaboration. I talked about it earlier for the front office staff. So when you see AI can help with scheduling, help with all these other things, billing, do you want to leave it entirely to the AI? Maybe in the future, but I think in the near future, it's going to be kind of a complementary tool and not a rip and replace. There's not going to be like, okay, now robots are your doctor and the front office is just not manned at all. You still need someone to welcome people, tell them to take a seat, things like that. But yeah, we'll see how things go in the future. But yeah, I think near future, we're going to see a lot more collab. And again, informed consent. I think patients already don't understand informed consent, although it's a necessity. I think it's nearly impossible to explain kind of the complex medical processes required to sign off. And a lot of time patients or their families are in a very emotional state. They're not able to understand the information, even if it was not so medical jargony. So I think it's a big thing now. We'll be acknowledging that AI systems are involved in their care, at least to say, hey, we're informing you that in addition to your doctor, an AI system was used, and providing sufficient information for the patient to make a choice on maybe they don't want AI involved in their care. So there needs to be another kind of toggle or something for that. But I'd say the informed consent works the other way too, where now doctors won't even understand how the system's working. So how can they explain how the system works to a curious patient? So this is another thing to keep an eye on, kind of the both sides of informed consent. And then lastly, how we can help at Ionix, integrations, tailored solutions, data privacy and security. We talked about all of these. And really the overall point I wanted to make on this slide, I added a little disclaimer. So it's really it's Ionix's role in implementing these AI solutions using APIs and other tools rather than creating the AI itself. So now I'm assuming in the future, and we're going to see a lot more people wanting to use GPT-4, whereas in the past we've seen a lot of other, people are white labeling different kind of things. I did mention Amazon Comprehend Medical, so that was one that we've worked in with the past. But our focus is helping on healthcare. It is on helping healthcare organizations adopt AI technologies in a responsible and effective manner. I think a large part of it is consulting, seeing exactly how they need to implement AI. We had a customer who asked for an AI integration, and when we talked to them, it was more like, hey, like you could just use Salesforce for this. So yeah, so it is like a lot of it's about marketing, saying I want to say that we're using AI and things like that. A lot of companies are coming out and saying that straight up, like, hey, like I need to get in this AI revolution. How do I implement AI? What do I do? So I think, helping consult with that's another thing that we do. And yeah, anything else? We have Q&A now. And if anyone wants to get in touch with me, here are my connections. So socials, LinkedIn. I am on Telegram because we have had a Web3 health project come once. So yeah, I'll go back to the room here for any questions, comments. All right, cool. Well, thanks for attending. We'll have the recording out as well. And please feel free to reach out to me. I am pretty responsive. Like I said, next week I'll be at HIMSS in Chicago, so maybe a little less responsive. But please feel free to reach out. And thanks for attending. Hope you guys found this informative.